really see the same problems over and over again.
Medication errors, improper monitoring, poor staff training.
Some of those things end really badly for people because they're sick, they're old.
I'm Fox 13 investigative reporter Taylor Stevens. Experts say these types of problems can sometimes lead to the premature and preventable deaths of Utah's elderly and disabled in long-term care facilities.
What we hope is that we're going to shine a light on this problem.
I've been looking into 24 deaths in Utah's assisted living facilities and nursing homes since 2019, as detailed in inspection reports and lawsuits.
Why didn't they give her emergency medical service? Why didn't they call 911?
As our Care in Crisis series continues, I'll explain why some are calling for the state to review more of these cases so they can identify root causes and better protect those who rely on this care.
Mom's life was dedicated to service.
Scott Diddy's mother, Ruth, spent her career as a registered nurse.
Training people to provide professional, expert, and compassionate service to those that need. That was her whole thing.
As Ruth began exhibiting early signs of dementia, her family wanted to make sure she received the same quality care she'd spent her life giving others.
Every one of us said, Mom, you can come and live in our house, we'll take care of you. And she was always kind of like, oh, I don't want to be in the way, I don't want to be a bother. She kind of wanted her own place.
Eventually, the family helped Ruth move to Covington Senior Living, an assisted living center in Orem. As his mother's health continued to decline,
she started falling regularly.
Then the day came when Ruth took her last fall, down an unsecured stairwell at Covington after attending church one Sunday in early 2024.
They found her there 6.5 hours after she fell. They didn't call 911. They didn't bring a doctor in. They just lifted her up and had her walk down the hall or had her walk up the stairs, put her in a wheelchair and took her to her room, put her in bed.
She died a few days later at the facility on January 24th, 2024, from what the lawsuit says was an undiagnosed brain bleed from the fall. The complaint also alleges Covington prioritized financial gain over Ruth's safety before her death by failing to reevaluate her services or to transfer her to a more secure memory care unit as her health declined. Instead, the family spent nearly $5,500 a month for add-on services the lawsuit says cost more than memory care would have. The add-on services included 2-hour checks, which don't appear to have been performed the day Ruth spent 6 hours at the bottom of the stairwell.
I hate to make it all about money, but if you're talking dollars and cents, it would have saved us money for Mom to be in memory care unit. And it would have taken better care of her.
Covington denies that claim and other allegations of wrongdoing in court documents. In response to a request for comment, the facility released a statement saying, Ms. Diddy was a beloved member of the Covington Senior Living community, and our condolences go out to her family. Covington cannot comment further. This case is in litigation and needs to proceed through the court process, not the media.
People want these facilities to be safer than they are, and they want them to be better staffed.
Jeffrey Eisenberg is an attorney with the Elder Care Injury Group, which is representing Diddy's family in its lawsuit and pursuing dozens of other medical malpractice complaints against Utah nursing homes and assisted living facilities.
More than half of them involve mistakes that were so bad that the patient died.
Some of their cases involve deaths allegedly resulting from sepsis, a severe bodily response to an infection. The complaints allege that resulted from untreated urinary tract infections or pressure wounds. Another of Eisenberg's lawsuits claims a patient at high risk for aspiration received a diet he couldn't safely eat and then choked to death on a breakfast burrito.
It was well understood that this person had severe difficulty swallowing. When the person started to choke, we think the evidence is going to show that the people in the facility didn't know what to do to keep that person alive.
Beyond the elder care injury group's lawsuits, we've identified at least 8 other ongoing lawsuits alleging that deaths in nursing homes or assisted living facilities resulted from negligence or poor quality care. The Utah Healthcare Association, which represents the state's long-term care industry, declined an on-camera interview, but noted in a statement that allegations raised in lawsuits are not findings of fact, and that each case must be evaluated within its specific clinical and regulatory context.
We hope that the accountability that the system brings is part, it can only be a part, but it's part of a solution.
I've reviewed thousands of pages of federal inspection reports and found regulators have cited Utah's nursing homes for issues related to at least 6 deaths since 2019. Some of those involved medical mistakes, as in the case of a woman who died of a potential accidental overdose after a nurse mistakenly gave her another patient's medications, then allegedly gave the resident all of her own medications as well, and didn't inform a doctor until her vitals began to drop. In another case, a nursing home resident with a severe pressure wound went septic and died in the hospital. Federal regulators said a doctor had never examined him at the facility.
We've just seen a lot of problems in long-term care.
Nate Krippus is an attorney with Utah's Disability Law Center. He feels state regulators haven't done enough to address what he sees as pervasive issues in Utah's long-term care facilities. One change he'd like to see is additional oversight through the state's fatality review committees, which take a closer look at deaths in state-operated or regulated systems.
I think the state really should conduct these reviews system-wide.
The goal of these reviews is to identify systemic changes, whether in law, policy, or training, that can improve services and prevent future client deaths.
Whether that is a perfect system and whether those reviews are finding all the problems they should, when a person dies in a nursing facility or an intermediate care facility or something along those lines, there is no similar review.
DHHS does review deaths of older adults in assisted living facilities and nursing homes if the person had an open case with Adult Protective Services at the time of their death or in the year before, but only if their death was deemed a homicide, suicide, or undetermined cause. Krippus says he's asked lawmakers about expanding those reviews to encompass more deaths of older adults, but he feels there's a presumption that elderly people in these long-term care facilities were bound to die.
I'm not going to disagree that when you're talking about an aging population, a lot of people probably are going to pass away in facilities. But again, I don't think it's too much to ask to then really take a look at what were the circumstances.
A DHHS spokeswoman told us the fatality review committees follow state law to determine which deaths qualify for a closer look, and that any expansion to those definitions would require legislative action. Asked about the idea of expanding reviews, the Utah Healthcare Association said it's always open to conversations about how to improve resident safety. But it said any additional review of facilities must be clearly defined, avoid duplicating existing oversight, and be focused on objective, evidence-based improvement rather than creating new layers of punitive review.
I would love to see change in the senior care industry.
For Diddy, he believes there were multiple points where his mother should have received better care, and he thinks her death was ultimately preventable with systemic changes, like the ones the fatality review committees explore, including better staffing, training, and oversight.
She devoted her life to training people to take care of others. And the tragic irony of
Taylor Stevens,
of how incompetence in the medical field contributed to her death is just
Fox 13 News,
it's just beyond words.
Utah.